Leaders in the Cherry Creek School District were fed up that they could not help students dealing with serious mental health issues. No available spaces in so many of the intensive mental health programs in our area. So the district decided to build its own day treatment facility that it will help run. It's such an unconventional idea that even the person who proposed it was surprised it got approved. Here's Anusha Roy.
Standing in the middle of this construction site, Dr. Tony Poole is beaming.
It's really exciting. It's really cool.
He suggested building Traverse Academy in Aurora that will open as a day treatment facility this fall, where kids can receive both treatment and continue their studies.
10 years ago, we had 77 placement options in the metro area for students with mental health needs. As of today, we're down to 16. And so when we went looking for solutions, the answer that kept coming back our way was, if you want day treatment spots, build your own.
16 facilities for the more than 540,000 school-age students in the metro area. So in 2020, during the height of the pandemic, Dr. Poole took his chances because they'd lost too many people.
We had lost several students to suicide in that school year. And at some point, after the loss of one life, enough is enough.
Cherry Creek School District ran a bond, and voters said yes to paying for the $15.5 million facility.
Because you can't learn if you're sad, you can't learn if you're sick, you can't learn if you're hungry.
Michelle Weinrob is the Chief Health Officer for Cherry Creek Schools.
If we can't keep up with them and their needs, and then we're not doing right by them.
But doing right by them means giving kids the right care. And Dr. Poole said people should be asking questions about a district helping run a behavioral health facility like this.
10 years ago, I would have said that school districts had no place in getting involved with therapeutical, clinical levels of mental health day treatment. I think that's changed. I think the crisis has gotten so severe that it's going to take all of us.
So on that last point, and a really important part of this is that it's Children's Hospital and CU that will be providing the clinicians to assure that quality of care. So what this is doing is it's really stepping into this major gap that we've talked about before, that gap between therapy and then kids showing up at the emergency room. Now, the school district said they were able to move some money around in their budget to pay for this program moving forward, plus, partnering up with a bunch of people and the fundraising. It's really important to pay attention to how it's being paid for, because so many of these facilities, Kyle, are operating in the red, and then you end up seeing them being shut down.
Yeah, or you see facilities that are physically built and then portions are empty because they can't find the staff to work them.
Yeah, and I asked that exact question. I'm like, how are you going to get enough people to come work here? They're really hoping that it's the innovation and increasing the salaries that will get people through the door. They said a lot of people are showing that interest. And Kyle, yet again, this is another group that's saying they want to go to the Capitol. They want to talk to lawmakers about reimbursement rates. And I know I sound like this broken record, but for years, every time I do this story, they say the same thing. Reimbursement rates will change the game.
Anusha, thank you.